Thank you, listeners, for joining us. Today's edition of our radio show, Elko Live, is a program that we have waited a long time to bring to the community because it signals the opening of a much-needed facility. It really is a labor of love and a dedication to our community, the Northeastern Nevada Regional Hospital Behavioral Health Unit. So we have today's guests who are professionals associated with the unit on the third floor of NNRH. Our guest today includes Steve Burrows, who is Director of Community Relations. Jessica Van Valkenburg is board-certified psychiatric mental health nurse practitioner, alongside our very own certified professional counselor, Director of Admissions for Behavioral Health at NNRH, Christian Anderson. And I say that because, Christian, you've been doing this for a while for our community. So thank you for being here.
Absolutely.
And thank you, Jessica, and welcome to the community.
Thank you, and thanks for having us.
Yes, absolutely. I'm going to start with Steve a little bit, Steve, just because we did announce here on the program that Behavioral Health Unit is staffed up and you're ready to go.
We are so excited to finally be able to open the unit. You know, it's been a long time in coming. Back in, last November, we had kind of a unit dedication ceremony. And at that point, we were fully staffed, thought we were ready to go. And then there was a little bit of red tape, just some extra T's to cross and I's to dot and all of those things. And so we have really fulfilled all of our regulatory responsibilities as far as that goes. We worked with a number of different agencies. The hard part was, we were staffed and then we lost a lot of that staffing because there was a delay. But as of this week, we are ready to open. And really, I think all of us at the hospital, we are just grateful to be able to provide this much needed service to the community. The hard part through this whole delay and through this waiting is knowing that there's patients who really need this care that have had to go elsewhere, that have had to go out of town to receive this care. So thankful that now we can start taking care of our community members close to home.
Thank you so much, Steve. Of course, with LifePoint, Director of Community Relations for our local Northeastern Nevada Regional Hospital. Before we get to talking about these services that these professionals are going to provide for us, maybe some particulars about that third floor and what it looks like now, what you're planning to offer.
So it's a 16-bed unit, and it really is adult behavioral health. So it's for inpatients who really they have an acute need for stabilization. And I'll let our pros here talk a little bit more about what that looks like as far as the medical support that we do. But it's really for people who are in crisis. It's not safe for them to go back home, and so this is a place where they can come and heal. So it's for adults ages 18 and up. And like I mentioned, it's a 16-bed unit. It's really meant to be an environment of healing and of support. I've been up on the unit recently since it's been finished, and it's very different from what I originally envisioned. I heard inpatient psychiatric care, and there's a lot of just stigma that goes with that. TV shows that we've seen. It is such a neat unit because it's really about healing and community and support. And so there's an activity area where our patients can have meals together if that's medically appropriate. If they can, go and interact with other patients, then we really want that. There's a place where they can do art therapy, just different projects. And it's I think, going to be a real positive for those patients where they can get back on their feet and get the tools they need to go home and be successful and flourish.
Thank you, Steve. Steve Burrows talking about the brand new third floor behavioral health unit for the Northeastern Nevada Regional Hospital. By the time this broadcast airs, open. So we'll talk about how to access this kind of care as well. Steve, should we switch over and talk to Christian a little bit about some of the particulars? And then,
absolutely.
Thank you so much. So as I was saying, Christian Anderson is known in our community. He is Director of Admissions for the new Behavioral Health Unit. But you've been doing this for a while here in Elko. Christian, if you wouldn't mind talking about the need that you saw for this service.
Sure, yeah. I first came to this area back in 2007. And I've started working with the hospital shortly after that, and have always worked with them in the capacity of dealing with mental health crisis when it arises, and patients that end up in the emergency room usually having some sort of psychiatric crisis that needs acute attention. And so I've seen this for a good many years now, and I'm just so excited to finally be able to offer this level of care to folks in their own town or in their own home area, instead of having to go so far away when they're already in crisis.
Yes, you said that so well, when they're already in crisis. And so, Christian, for people listening who've been awaiting this service, what is a behavioral health unit? Again, this is something that's evolved over time. I mean, Steve mentioned it. We've seen negative connotations in media, but we want people to understand NNRH has created a healing space.
Yeah, we have. So, mental health treatment in general has come a long way, and it can involve a lot of different things, but kind of at its roots, it's essentially a combination of medications and therapy. And those things can be gotten on an outpatient basis, which we've had, available on a somewhat limited basis, but at least available in this community for a good long while. But sometimes that's not enough. And when people are in crisis and perhaps even in danger, then a behavioral health unit is designed to provide those services, the medication and therapy, on an inpatient basis in a secure environment. And so that's what it's for.
So it's a safe and secure environment. It could be long or short term, the way that you were describing it, right, Christian?
Yeah, it would be mostly, average length of stay at a place like this is about 5 to 7 days. Now, that's not set in stone. It can be shorter, and it could be longer depending on the need, but that's about average.
But that can really make that difference to stabilize someone, to help them understand maybe some of the underlying issues. The medication that you mentioned, this could be huge, because we hear stories, people had to go out of town, they were transported, maybe even without being fully participating in that, and then they didn't even have a way to get home.
Yeah, unfortunately, that's happened pretty regularly. It's considered a medical emergency to get a patient someplace to get the care, but then once they get the care, they're not really considered an emergency anymore, and so they're sort of left on their own to get home, and that's always been such a burden for folks, and so it'll be so nice to not have to put that on people.
Christian Anderson is our guest alongside Steve Burrows from the Northeastern Nevada Regional Hospital. We're going to talk with Jessica Van Valkenburg next. And we'll come back to you, Christian, obviously, because this is an important conversation for all of us, for our whole community. And well, first of all, we want to welcome you, right, Jessica? Are you new to the community?
I've been here about 4 years now.
Okay.
But
you came from somewhere else.
Yeah, exactly.
So we appreciate your being here.
Thank
and
you.
So what is the work of a psychiatric mental health nurse practitioner? That is a very specialized field.
It is. It's kind of like a psychiatrist. I was a nurse for a really long time, like 12 plus years, and then I worked in the emergency room and got my nurse practitioner, and now so I can diagnose and then also help with like medication management.
So you've seen in 4 years or so some of the situations people find themselves in Elko, right?
Yes, definitely.
Okay. So what we wanted to know, too, is in your experience, and you've seen people that have had to go out of town. So what is different about our behavioral health unit now, open on the 3rd floor of the hospital?
It'll be so nice because it'll be right here in our community. It helps, I think a lot of people, when they hear that I have to go to Vegas or Reno, and again, I don't have a ride home, how am I going to do that? I think it hinders people from getting the help that they need. When they know that they can come to their own community, they can get the help on the 3rd floor, they don't have to travel far away. I think that just really helps facilitate that. And then it also helps build support, because their families are usually still here and they can come visit them, and it's just not as scary, I feel like.
And so our rural hospital, of course, NNRH, we are used to seeing patients use the emergency room for a lot of things, right, Jessica? Mm-hmm. So you've probably seen that over the years, where people really need to get into treatment.
Yes, Definitely. I feel like they just don't know where else to go, and so the ER is the place, and that's great. Like, that's the first great step, and they can continue to do that. But now we have the second step where we can take them upstairs and help them heal and get them back on their feet.
Thank you, Jessica. So, Christian, you are the intake director, so maybe walk us through the process a little bit, since we're just getting started on this.
Sure. So when people go to a unit like this, they usually get there through the emergency room, through their local emergency room, and that will continue to be the case here. And they'll come in and they'd run just a brief, like a medical screening to make sure that there's nothing going on that needs medical attention. And then we'll have them just come upstairs as long as we have a bed available, and we contact whoever the admitting provider is at that time, and bounce the case off them and make sure that it's something that we feel like we could help with, and then we'll just bring them upstairs, and it should be a pretty simple and easy process. Certainly much more so than it has been.
Yeah, taking someone in crisis hundreds of miles away to not only a strange city but strange surroundings. So this screening that you're talking about, it could include, like you said, evaluating for some physical symptoms. Do people with mental health issues, whether they're in crisis or not, but do they often have maybe masking or other issues with addiction?
Yeah, that's very common. And while we won't be doing specifically addiction treatment on the unit, we understand that those things often occur simultaneously, mental health and substance abuse issues. And so we expect that a lot of the folks that we see and that we treat there will have those kind of co-occurring issues, and we'll be prepared to help try to address those as well.
We understand, Christian, that NNRH is really proud, and even Steve can talk about this if you want to, but that collaboration is important in this relationship. There will be other providers and others in the community who will be helping facilitate the overall outcomes, right?
Sure, yeah. We are working very hard to develop those relationships with folks, doing a lot of outreach right now. Steve is working hard to get all of our relationships with everybody so that we can refer patients back and forth between ourselves and the local providers that pick up the ball when we discharge people, and try to carry it further down the field and help people to continue with their care.
Did you want to talk about that, Steve? Because that partnership is important, not only just the initial crisis, but certainly the discharge. What Christian just mentioned is almost as important. It's stabilizing a patient initially and then getting them that continuous care.
Absolutely. I think we've seen a real increase in collaboration. I think even coming out of the pandemic, I think we realized, hey, we all need each other, and our patients need us to be working on the same page, so that there is that continuity of care. We've really built some great relationships throughout the community. I want to give a shout out to the Zero Suicides Elko County group. They have brought people together, and Lynette Vega and their board, they've really made it where folks can collaborate. But we've started, just working more hand in hand with some of the local providers, as including Vitality and integrated programs, and then our friends at Nevada Health Centers. All of us are here for this community, and we're really on the same page. I think there's a lot of resources that are available, and I know that Lynette Vega has those Elko resource cards, and you can actually visit the Zero Suicide website and check those out, because there's more resources in this community, I think, than a lot of people know. We don't look for resources until we need them, and when folks need those resources, they really are available. So I'm glad that we can make those connections.
Steve, thank you again. Steve represents Northeastern Nevada Regional Hospital. So I guess, Christian, and we want to talk more with you, obviously, Jessica, but people listening might say, okay, so it sounds like the way that we access behavioral health unit is to first go to the emergency room. Is that the right way to get things started?
That is certainly a way. That's the way that most people end up there. Even when when folks will call like a 988 number or some other kind of crisis hotline, that is a way to reach out for help. But a lot of times they'll be directed then to the local emergency room for further help. And so.
Okay. And then before we sign off today, we will talk to Steve about, because people listening might say, yeah, but how do I pay for the treatment, right? I mean, affordability, that's also an important aspect of having local treatment. So Jessica, back to you. And as a psychiatric mental health nurse practitioner, you get to help create that environment that we've been talking about there on the third floor, right?
Yes, definitely. We want it to be a healing place that, like Steve mentioned in the media previously, it makes it sound really scary, like, I'm going to a psych ward, but we're there for the patient. We want them to be involved in their care and every step of the way, and it's just a nice healing environment. They're not isolated. They can mingle with other patients and get to know our staff really well. We have group therapy. We have multiple groups throughout the day to help them to learn the coping skills that they need, and then they'll get to see a provider every day as well, whether it be myself or Dr. Jonica. And so we're just really trying to make it a good place and a good experience for the patients to get back on their feet.
And you mentioned music, art, therapy, that kind of thing, right?
Yep. We have an activity therapist. She's one of our occupational therapists at the hospital, but she can do both. And so she set up many different activities for the patients to be able to do. They can utilize clay and puzzles and a lot of art stuff, just so that they have that creative outlet so they can kind of just blow off steam. We're also going to utilize journals. We have yoga. We have karaoke machines. So we can do music. So it's going to be a fun thing. It's not just I have to go up there and get locked up there. We want it to be a very healing place.
Mm-hmm. You might be in crisis when you first arrived, but I know when the community, we got to tour the facility as it was being developed, and all of these, the actual spaces were evolving, and there were some beautiful views, and there was a lot of sunlight in there too.
There is. That was one of the things that Christian and I were really we didn't want the blinds to have to be closed. We wanted them to be able to, they could see out. We want the sunlight to come in, and it is a great view up there.
Yeah, it really is. You get that. I think you can see the rubies from that side, if I remember right. Maybe, well, you can see some mountains anyway. Yes. Maybe they're foothills, but you can see the outdoors, and that part of nature too is an important part of healing. And so, and Jessica too. People have there are a lot of concerns that people might have. For example, if they're admitted, can they have visitors? And yeah,
they can. We actually have visitation scheduled every day from 2 to 5. So we'll set it up with their families, so that way, because our staff oversees all of that, but they can have their families come up. They can also talk to them on the phone every day whenever they want to. So mental health doesn't just affect the patients, it also affects the family. And so keeping them involved in the care is also huge and can really help benefit them and also help them to be successful.
Well, thank you, Jessica.
Of course.
Really appreciate the conversation today. We're talking about the brand new Northeastern Nevada Regional Hospital Behavioral Health Unit. There are 16 beds. It's for adults. It could be largely a short term, what we understand, anywhere from 5 to 7 days, but it helps stabilize people, Christian, in crisis. So as we were talking here, is there anything that we are overlooking, Christian, that you want to make sure that we're including in our discussion today? Anything that pops into your mind as far as?
I think that I would just point out that all of us are susceptible to a mental health crisis. We've talked a little bit before about how there's kind of this stigma around that, and especially in older movies and stuff like that. You see, maybe you get a certain picture of what a mental health crisis looks like, but each one of us has a brain, and none of us has a perfect brain. And we all also have complicated lives, and we go through big highs and big lows in life. That's just part of the human condition. And so I've seen, just during my time here in this area, and in every area that I've worked in really, but nobody is immune. There are, I've seen highly successful professionals and people of all ages and every kind of person you can imagine who at one point or another goes through a crisis and needs to reach out for help. And there's nothing wrong with that. It's no different than reaching out for help for any other medical problem.
And Christian, just as you explained, I mean, it could be something temporary. People will say, well, if I go to a behavioral health unit, I mean, I know I'm crashing. I know that I have these issues, things I don't understand. There is that stigma, as you mentioned. Do people have like a permanent record? Does that make sense? Well, he's smiling, so good. These aren't silly questions, but
no, I think that people do get worried about that, and I hear that. I hear that concern expressed from time to time. Now, this is medical care, and so it's under the same strict confidentiality guidelines as all your other medical records, and so you're in charge of the confidentiality of those records. Each patient owns that, and so each patient gets to decide who knows and doesn't know about it. And so it's nothing that gets published on any website or on any database anywhere that anybody could get access to.
And that's important, part of that process of healing. And I think you'd mentioned too, Christian, medications. Sometimes people going in know that maybe they've neglected medication or they thought it was okay to go off, or there could be different reasons. And you have staff on hand to help with the medication, obviously.
Yeah, we do. That's that's hard to come by actually in this community. We don't get a lot of psychiatric specialists, and so that's part of why we're so happy to have Jessica here, because psychiatric medicine is sort of its own thing, and it's complex, and it's great to have somebody here that understands it and can help us out with that.
So I saved this question for you, Jessica.
All right.
Yeah. So how do you know if someone you care for, maybe it could be, yourself, but you hope that you have people around you. But how do you know if someone you care for needs mental health help?
Usually it's when they start acting different than their normal day-to-day. Like it could be they're neglecting their care, they're not showering, they're not brushing their teeth, they haven't left the house in weeks. They could be talking to things that aren't there. There's multiple, it's like a spectrum. There's multiple things. So if ever you're concerned, get them the help and check in on them. Even if they are seem like they're happy and, oh, I'm fine, they can be definitely masking and they could need the help, Our goal is to help all of those that are endangered to themselves and to others and just neglecting their care. And
do you think, Jessica, it's sometimes people too also think, oh, mental illness is like a terminal disease or an illness, right? But people live with mental illness, or it can be episodic, or it can be just a one-off. Is that right?
Yes. Yep. Absolutely. Like Christian mentioned, life's hard, and there are different things that can be triggering, like a loss of a loved one, or I'm just grieving, I'm trying to get through it, and so there are things that can just cause the depression or whatever, and it might. Once you get through that, you're good. You don't ever have any other issues. Or you might, find a few years down the road, you might have another episode. So that's what we're here for, you guys. We're here to help you understand what's going on with you, how to help treat it, and how to become the best person that you can be. Just get back on your feet and just feel more like yourself.
Jessica Van Valkenburg is board-certified psychiatric mental health nurse practitioner, and she is among the professional staff and leadership at the Northeastern Nevada Regional Hospital Behavioral Health Unit. And same question I asked Christian. I wanted to make sure that we were getting to the topics you were hoping to address today, Jessica.
I think you've nailed a lot of them. I just want, we want to help our community and the outlying communities, and we can take direct admits. If you can't get them to the ER, get them to their primary care doctor, and we can work through that. So it's not, there won't be such that financial burden. I know a lot of people are I don't want to go to the ER because, I'm at my doctor's right now. The doctor can help facilitate that. We can take all of the patients. We just want to be a helpful hand. And if providers in the community just have questions, they can always call and talk to us and find that out. And so I just want everybody to know they're not alone. We are here. It's a new resource, and we want to be of help however we can to the community.
Thank you, Jessica. Really
You're
appreciate that. Yes. And I would say, so we can switch over to Steve. Not that we'll cut you out Christian, because obviously sometimes as we get to the end of our conversations, people think of other things. But we said we would tell people about payment plans or how to pay for treatment, for example. So thoughts on that?
Absolutely. We don't want payment to be a barrier. We don't want people to be afraid that, man, if I go to the hospital and I'm admitted, I'm never going to recover from that. And that's not the case. I do want to let folks know that we are set up with Medicaid, with Medicare, with those different health insurance plans. There's been a lot of work that's gone into laying the foundation for that. And we also, when it comes to mental health, when it comes to emergency care, we want to make sure that people don't stay away because of, the financial aspect of that. Our commitment at Northeastern Nevada Regional Hospital is to take care of every patient that comes to us, regardless of their ability to pay, regardless of whether they have insurance or don't have insurance, whether they can pay or not. We're going to care for them, and we want to provide that care. I just looked at our community benefit report because I wanted to verify the number, but just in 2024, we provided $16 million worth of care that we weren't compensated for because people couldn't pay. And that's why we're here. That's okay. We want to take care of everyone. So I would just let folks know that, payment and the financial aspect of it shouldn't keep them from seeking help. There's not a price you can put on your wellness and your mental well-being. And so we will work with people, always encourage folks to contact us if they have billing questions, to call us locally, and let us help work through those. We have an awesome patient financial services department there at the hospital. They are so helpful to bend over backwards just to meet people where they are. So as far as the finance goes with it, I just encourage people to get the help they need, and we will work with them.
Steve Burrows is Director of Community Relations for the LifePoint Northeastern Nevada Regional Hospital, the brand new behavioral health unit, which at the time of our broadcast, we're on the doorstep of opening, but open to the community. And the main number to call, because as Jessica said, if someone just has a question saying, should I bring my loved one or should I take myself to the hospital, just to call that main number, Steve?
Correct. So folks can call 775-738-5151. That will get them to the hospital switchboard. We do want to encourage providers to, call directly, and they can call Cindy Gates, who is our director, just to talk through, if there can be a direct admit, and if patients can come directly to us without going through the ER, we're certainly open to that as well.
So happy to help you with the outreach. Again, this is one of the most critical missions of our community, certainly of the last couple of decades, and we know it was a huge accomplishment, and you worked through it, Steve, meaning you and the other leaders, certainly LifePoint as a corporation, they made this a priority, and we appreciate it as a community, so thank you so much.
Absolutely. We've had a lot of support from the community, from the county commissioners, the city council. The city of Elko, was able to help with some of the ARPA funding and actually to get the renovations going up on the third floor. There have been so many people that have come together and said this needs to happen in our community. And I do want to thank LifePoint Health. They have been instrumental every step of the way because they realize that, in the day and age we live in, this is a huge need across the country, but especially in smaller towns and rural areas, there's a huge need for access to care. So we're grateful to them for their support.
Our guest today, Steve Burrows, Director of Community Relations. Jessica Van Valkenburg is board-certified psychiatric mental health nurse practitioner. And Christian, we're going to give you the final word, I think, as certified professional counselor. He's the Director of Admissions. He's doing the intake for behavioral health at NNRH. And you also have a very special skill, and I hoped you wouldn't mind. Can you give us a message in Spanish, maybe appealing to people, since you are bilingual? And that's important for this position.
Sí, si ustedes necesitan ayuda mental, ayuda con su salud mental, por favor, pónganse en contacto con nosotros para que les podamos ayudar.
That, of course, was an invitation, I think it was, for anyone who is in need of medical help, mental health help. Please reach out to the Northeastern Nevada Regional Hospital, 775-738-5151. Christian, thank you very much.
Absolutely. Thanks for having us.